Good afternoon. Welcome to this monthly meeting by IHE-Europe. After the summer break, we are back and we welcome you today. So the topic of today is the National Digital Health Ecosystem in Hungary. We are very pleased to welcome Gergely and Orsolia, together with Sofia from IHE-Europe. Before we start with our Hungarian speakers, I will pass on the floor to Sofia. And please note that the questions will be raised at the end of the session. The session will also be recorded and made available on the IHE-Europe YouTube channel, where you can also rewatch all of our previous monthly webinars. And the slides will also be made available on our websites. So don't hesitate to put your questions in the chat or be ready to speak up at the end of the session. I pass now the floor to Sofia Franconi from IHE-Europe.
Thank you, Caroline. So, waiting the people to join the webinar, I just wanted to say a few words about IHE-Europe's activities. So we have our next Connectathon week that will be from the 23rd to the 27th of March in Brussels, in the room called the Egg, which is next the Midi station. So there we will have the typical activities, so the IHE-Europe Connectathon, so this big testing event that we have, but we will also have the same as last year, a plugathon on some European topics more related to EHDS and the different projects. And of course, we'll have the 1 day and a half conference, the experience days. So also they're focused mostly on EHDS. So this Connectathon week is the opportunity for you to meet several stakeholders, so from industry, from healthcare, policymaker or innovator, and together to share experiences, to test, and to network, of course, and to be aware of the latest development. So to prepare a bit for this Connectathon week, we are organizing our next webinar that would be on the 28th of November on EHDS, so how to get ready for EHDS using IHE. So it would mean which IHE profiles could be ready for EHDS, and also link with the different projects that are interacting in the EHDS. So I invite you to go and take a look at our webpage just to keep informed. The registration should open soon. For the Connectathon itself, it's already open, but for the parallel event like the plugathon or the experience day, that will be soon by the beginning of November. So I think that's all for me. I will pass the floor again to Caroline to introduce the two speakers that we have today. Thank you.
So as you can see, we have two experts today from Hungary, from OCFE, the National Directorate General for Hospitals, which serves as the national authority for healthcare in Hungary. It operates and oversees more than 100 state-owned hospitals and playing a crucial role in the coordination, development and quality assurance of healthcare provision and services in Hungary. OCFE monitors the operation of the healthcare system. It facilitates strategic government decisions concerning the revision of the healthcare provision and contributes to the establishment of a new integrated, transparent national healthcare.
This is Gergely speaking. Can you see my screen?
Yes, Gergely. If you can hold on a little bit. Yeah. So I was explaining what OCFE does. You do hear me, right?
Both of you?
Yes, Gergely. Just hold on a little bit. Do you hear me, Gergely? So I will continue the introduction of IHE. So IHE holds responsibility for the allocation of primary care practice rights, and as such, it plays a key role in shaping Hungary's e-health strategy. So Gergely, who you already heard, which has currently some sound issues, apologies for that. Gergely Heya is an electrical engineer and biomedical engineer. He has more than 2 decades of experience in e-health standards, medical knowledge, representation, and semantic interoperability. Gergely has participated in several EU-funded projects on cross-border data exchange, APSOS, CFF, EHDSI, and the recent X projects. He was also one of the key experts during the design, implementation, and rollout of the Hungarian national e-health infrastructure. And currently he's working as a part-time consultant for IHE on extended EHR and the eCan Plus projects. So on top of Gergely, we also have Orsolia Besse. She's a project manager at the National Directorate IHE, having more than 15 years of experience in health and social sector, and has contributed to large-scale European health projects that drive the systemic changes. Orsolia contributes to strategic initiatives that foster European health data interoperability and digital transformation. She has played an important role in several EU-funded projects, including secondary use project and primary use project, health data at EU pilot, Expand DH, TEDAS, TEDAS2, the joint action, extended THR, XDSI-NS, and the eCan plus joint action. It's all these projects support the cross-border data exchange, the adoption of the European health record exchange format. Orsolia has contributed to efforts providing practical guidance and technical recommendations for the implementation of the EHDS. So as you can hear, Gergely and Orsolia are very senior experts in the domain, so very happy to have them today. Welcome. Thank you for your time and the preparation. So we will first have Gergely and then Orsolia, and then we will have some time for your questions. So you can prepare them your preference. The floor is yours, Gergely. I hope you can start sharing your screen. Great, we see it in a perfect view. The floor is yours, Gergely.
Thank you, Carlian. Sorry for the audio issues. Some problem happened with my audio driver. So I will speak now about the Hungarian National e-health platform. So first, a very brief overview of how the Hungarian health sector is organized and how it's built up. So the public sector is reimbursed through social tax. There is a central agency called Health Insurance Fund that reimburses the healthcare activities in the public sector. The inpatient providers are mostly state-owned. The outpatient providers are either state or municipality owned. The GPs and pharmacies are typically privately owned. And most importantly, the whole system is organized on a national level. So we have national authorities that maintain registries of all the healthcare professionals working in the field, all the healthcare organizations, including the pharmacies, and there is also a central terminology, the various code systems and other classifications that are used by the healthcare sector. And there is also a private sector in Hungary. There are some hospitals, but mostly these are outpatient healthcare providers, including laboratory and imaging diagnostics. So The name of the Hungarian e-health platform is EST. It means more or less literally translated to English System of Electronic Health Services. So it's a centralized system. It resides into clusters. There are a lot of virtual machines running in these two private clouds, and it provides a high availability service to the users. There are about 170,000 people working as health professionals in Hungary. So that means the physicians, the pharmacists, and the various associate healthcare workers working in either pharmacies or in hospitals or in the GP office. Hungary has a bit less than 10 million citizens, and there are hundreds, nowadays even thousands of systems that are connected to the national health platform. And the health platform collects, stores, and makes available medical data, which is, of course, of a highly sensitive nature. And it also provides certain code tables, rule sets, and other information that can be used for sector management. It is stipulated by law, so first a very detailed and specific legislation has been put forth before the EST was turned on. It provides a central bridge that connects the various healthcare domain actors, and it provides services to both healthcare professionals, patients, and also to certain governmental bodies that are active in the health sector. So I told what EST is, and now I'm talking about what is it not. So it's not a completely independent gigantic system. It's not a new hospital information system. And it's mainly an infrastructure in the healthcare domain and not only a communication channel. It evolves continuously, so the services are extended from time to time, so it's not a finalized and closed functionality, and it is meant to handle health data for providing care to the patients. So it's not meant for reimbursement. That's a separate system maintained by the Health Insurance Fund. But certain information coming from EST are used during the reimbursement process. So as I mentioned, it's mandated by law. There are separate acts and either government or ministerial decrees that govern how EST works, what kind of information it is allowed to collect, what kind of users can access these health data, and also governs what actors shall send to the EST. So these are electronic services. So as I mentioned, the most important audience are the health professionals, mainly physicians and pharmacists and other people working in pharmacies or at medical device vendors. The healthcare providers, the organizations, are also users of the system. Typically, they are only allowed to publish data to EST, but there is a very limited query availability of such organizations. It's practically limited to the e-referral and also to the access logs belonging to information from that organization. The other important set of users are the patients, the citizens of Hungary. Every citizen can have access to EST. I will talk about the details later on, but the idea is that people are allowed to view all their data in ST and also see who has accessed them or who has attempted to access their data. And also governmental agencies working in the health sector can access ST. Mostly it's about publishing the various registries and code tables, but also certain aspects belonging to reports in the healthcare sector, mostly reimbursement is also involved. In Hungary, there are about, so this is the public sector, there are about 6,000 GPs, 300 outpatient clinics, more than 100 hospitals, and 3,000 pharmacies. And these health care providers must connect to AST and use the services of AST. So this is the context of AST. It's running within the private cloud services in the data center of a Hungarian national organization that provides the IT infrastructure for the whole governmental field in Hungary. So not only for healthcare, but all governmental users. And around here are the various organizations and people that can access AST. And international relations here at the top is currently being worked on within the My Health program. So what are the main services of AST? Event catalog, digital image transfer, e-profile, e-prescription, EHR, and e-documentation and e-referral. And these are services available both to the patient himself, herself, and the appropriate healthcare providers treating that patient. And how can people access the services of AST? So professionals typically use their own medical systems, which have been augmented to allow communication with the AST. But there are also two professional portals with a somewhat limited set of functionality that can also be used for connecting AST. For patients, there is a patient portal. It's a web portal. And there is also a mobile application called IHE-Europe, which can be literally translated to English as Health Window. And certain functions are available through a government office. It's meant for people, digitally illiterate people who cannot themselves use modern applications. So for these people, there are certain functions available through a government office. Now I will quickly summarize the various services of AST. So the event catalog is practically a log of healthcare encounters. So if a healthcare encounter takes place, then the healthcare provider providing medical services during this encounter are mandated to send these entries to the catalog. It contains administrative data, the patient, about the organizational unit itself providing the service, and also some very basic medical data about the healthcare encounter. The decree that governs the data handling of AST specifically lists all the kinds of encounters that have to be reported to AST. And using this information, a chain of the healthcare encounters, so the life of the patients through the healthcare system can be connected together. And also the EHR documents that are created during this encounter are linked to these entries. So it can be used to quickly get all the relevant documents that have been created through a during this encounter. The second services is the EHR electronic health record repository. This is a collection of there is a detailed legislation detailing what kind of documents and when are to be reported to the AST. This can be unstructured PDF documents, but also there is possibility to have them in a structured format. I will talk later on about the structured documents. If a document needs to be changed because there was, for example, for laboratory, certain parameters that haven't yet been measured, then a new version of the document has to be published. And the version history of these documents is maintained in the system, and the physicians later on treating the patient can also see the version history. So all the documents about the patients will be seen by the patient himself or herself and the other professionals treating the patient, and there are rules when these documents have to be published to the AST. This is maybe the most liked or most popular service of AST, e-prescription, so electronic prescription and dispensation. It is the electronic counterpart of the traditional paper-based prescription. In 2017, when AST started, it was limited to medicinal products or drugs. But later on in 2020-21, it has been extended to most of the medical devices as well. And there is this so-called certificate, which was originally paper-based, but now it is also available in a digital format that allows to redeem such prescriptions in the pharmacy, not by the patient herself, but any representative of the patient. But also, if the patient goes there or a trusted representative goes there, the Social Security paper-based prescriptions still exist, so there are cases when the physician is not to issue an electronic prescription. In this case, the paper-based prescription will be registered to the AST in the pharmacy when that prescription is redeemed. The medication history that thus becomes available for all the users, and it's not important whether the original prescription was electronic or paper-based. Physicians or pharmacists will be able to see what kind of medication the patient is taking to check for certain patient safety issues. The system also provides prescriptions for medical devices. The life cycle for medical device prescriptions is somewhat different because medical device needs approval by the health insurance fund, and so these additional states are also maintained by the system, and the health insurance fund has access to such prescriptions, and the approval process is now also digitalized. As I mentioned, there is a paper-based certificate during the startup of AST. It was mandatory printed and also not on any kind of paper, but strictly on the prescription form provided by Health Insurance Fund. And since 2021, blank paper can be used. And there is also a digital certificate which can be issued either by the issuer of the prescription or a QR code can be generated in using the mobile. Similarly to e-prescription, referral is the electronic equivalent to traditional referral. In Hungary, referral is needed for reimbursed health healthcare and for non-reimbursed private services, you don't need to have a referral, except for ionizing radiation, so CT, PET, and similar procedures. You don't need to exactly have a referral, but a not such formalized request by a physician, because having a CT is dangerous. So they won't do a CT scan for you if you just walk from the street into such a healthcare provider. But on the other hand, if you want to have a blood chemistry measurement, you simply go there, pay the fee, and will get the results, and there is no need for a request from a physician. But in the sector, several kinds of procedures do need a referral by a physician working in the public sector, and the e-referral is the tool to that. Paper-based referral is still a valid option. Certain settings are still allowed to use paper-based referral in the normal case. And if there is a communication with AST, communication problem with AST, then of course paper-based referral is a valid option for such a business continuity procedure. Related to e-referral, there is the so-called resource publication and scheduling component. Here, the healthcare providers can publish a calendar and a set of resources like various services they provide through the ASA, and patients having referrals can check these calendars and provided services and select a date and time and bind to the e-referral they have. And with that, either the original physician issuing the e-referral or the citizen later on can book appointments to have that e-referral used up. E-profile is the same as the patient summary. User might have set a word, so it's practically the same, because the patient summary guideline was already published when the detailed design of AST was done. So the data model in AST is built using the patient summary guideline. So it's a collection of citizens' medical data, the most important and practically unchanged or relatively slowly changing data like chronic diseases, implants, allergies, things like that. And here again, the respective Hungarian legislation lists the pieces of information that are part of the patient and that are based on the line. This is the only in AST where the citizen has the possibility to prohibit the upload of the digital consultation part about how the citizen can govern access to his or her data. But here, the citizen has the right to prohibit filling out the patient summary. In all the other cases, the documents or other digital objects are always sent to the EST. The next component is the digital image transfer. So it enables to share or access digital images like X-ray images or CT scans between healthcare providers. So it's not meant to be used systemically through this possibility. Suppose the center and the part need to have a, and so one part is that the scans, the digital images, are registered into the AST database, but only a link and some metadata about the image is stored by AST. And if another physician wants to look at these scans, then they can use the database, query and filter the results. And based on the links, they are able to request the digital image from the original creator of that image. A secure email is also possible, where images can be directly sent from one department to the specified healthcare professional. This is really secure. So we are not talking about email. We are talking a highly secure system where information leakage is not practically not possible. And the third main service of digital image transfer is the consultation based on digital images. And the last medical, so-called medical module of AST is telemedicine. It's called telemedicine. This is personal health record, meaning these are health data collected at home by the patient. So if the patient has a smart medical device like a glucose meter or a blood pressure meter, and the vendor of this device maintains a gateway system that allows to send data from the device to the AST, then such information will be collected in AST. This is using structured data based on FHIR. So this is currently the only part in AST that is FHIR-based. And this is the only kind of medical data in AST that is not coming from a health professional, but from a layperson. But this is not data entered by the layperson, but from the medical device the layperson is using. One of the, I would say, most important components of AST is digital consent management. So this is an access control mechanism that allows the citizen to govern how his or her data will be used. The foundation for the consent management is a so-called categorization, where the digital object, the digital health data, is automatically categorized according to the various specialties in medicine. And there are some very special, very sensitive specialties which are handled by even greater care than the other parts. That is psychiatry, including narcotics, and the other part is sexually transmitted infections and other related diseases. So such are only available to physicians working in this field, actually working in departments that are authorized by the appropriate governmental agency to provide services in this field. All the other kinds of data are by default available to treating the patient. And the citizen can use the categories to have stricter or not so strict rules to be set. So a patient can state that I don't want to have my data accessible to anyone, except, for example, to my GP and to the specialist I regularly go to. But all the other physicians working in Hungary will not be able to see my data, except for the emergency situation. So when the patient is unconscious and in great danger, then there is a so-called break glass functionality that can be used by the healthcare provider, which makes open this restriction and can access all the data of the patient, because it is needed to save the life of the patient. Pharmacists are only allowed to access the medication history of the patient, and assistant workers working in pharmacies can only access the still open prescriptions of the patient. And this component not only provides the control to the patient to set the rules, but also the citizen can have a look on the access log, and he or she can check which healthcare providers and which healthcare professionals have accessed their data or tried to access their data. And this component also provides a kind of power of attorney, so the citizen can allow certain other laypersons to act on their behalf, redeeming prescriptions and accessing AST in their name. How data is sent to AST, so EHR documents and even catalog entries are typically automatically sent by the health information system, so no manual intervention is needed there. And on the other hand, issuing an e-prescription or an e-referral or editing the e-profile is a manual act, and it is restricted to physicians. And as I mentioned, also the default data access is limited in this way, and this can be either broadened or narrowed by the patient for physicians and pharmacists. And the patient has unlimited access to their own data. How data are accessed from AST, so healthcare professionals mainly use their own system. So the healthcare information system or pharmacy information system they're already used have been extended to allow communication with AST. The access is strictly governed, so only really existing physicians or other kinds of professionals working at a really existing healthcare provider are allowed to access AST. And citizens are authenticated through e-government services with multi-factor authentication. So again, it is a very secure way to access data. There is also a very detailed procedure how a new healthcare provider wanting to connect to AST is allowed to access AST, and a very detailed paper-based step-by-step procedure is mandatory. So the healthcare provider has to prove that it really exists. In Hungary, it has license to operate in Hungary as a healthcare provider. It also needs to get a certificate to access it by a certificate authority that allows the electronic to build up the electronic communication channel with SDA. And without taking all these steps, it is simply not possible to access data from the SDA. There are also some professional portals. One is the so-called mini hospital information system, which is a web-based medical system for GPs and also for outpatient care providers. Except for digital image transfer, it supports all the services of AST, meaning that it can be used to send event catalog entries, issue prescriptions, send EHR documents, and also to query the digital objects of the patient from AST. Also supports reporting to the health insurance fund. The other professional portal is to medical device vendors. It is practically meant for small vendors who didn't have an electronic system beforehand. And using this system, they can query the prescriptions, the medical device prescriptions, and dispense them through the AST. And this portal does not support reporting to health insurance fund. It has to be done in the traditional way before using this kind of service. Because it is a central system and all the healthcare providers connect through the internet to it, it can have similar available to the particular healthcare provider. In this case, a so-called BCP, business continuity process, are defined. So in this case, only paper-based prescriptions are to be issued. A paper-based referral is also to be issued, but in this case, a follow-up referral is to be sent to AST when patient is back. And all other practically automatically sent entries to e-catalog and EHRs are stored in the local system and automatically sent to AST when the connection has been reestablished. So regarding patient access, the citizens have two electronic ways to access their data. One is a patient portal. This is a web-based system. And there is a strong two-factor authentication provided by governmental authentication services, and the patients can have full access to their own data, full access to their consent management data, including the access logs. And if this particular citizen has a power of attorney for another citizen, then it is possible to switch to that kind of profile and use the patient portal in the other person's name. And there is also a mobile app for both Android and iPhone devices, which is also similarly strictly governed how the access to AST is possible, and it can also be used to access all kinds of data available in AST, and there are some additional smart functions of the mobile app that are not directly available in the patient portal. In 2017, when AST started, all the HR documents were in PDF format, and the code is very simple. It was still hard for some healthcare software vendors to make the step to change their systems to be interoperable with AST. And the step would have been very big if structured documents would have been already introduced, because most of the EHR documents that are sent to AST were also printed and given to the patient in paper form. So printing on paper and printing a PDF and sending it to AST was not very complicated. So that was the reason for deciding for this. That years have passed, and there is an continuously ongoing roadmap to having more structured documents in EHR. So the COVID certificate of infection and vaccination is a structured document. There is a so-called medication indication by specialist in Hungary. That means that there are certain kinds of medicinal products where first a specialist issues this kind of document, and the GP of the patient can then issue the prescriptions based on this medication indication. And this kind of document has already been digitalized, and also laboratory results are available in a structured format. Not each and every kind of laboratory result can already be represented in such a structured document, but the most frequent one, if I remember correctly, it's a bit more than 400 parameters, but these are the most frequent and most important laboratory parameters that are measured. And as I previously told, the personal health record uses FHIR as the structure. What I told until now is the internal, so the Hungary limited services. There is an ongoing effort to make e-prescription and patient summary, and also the additional EHTS use cases available in a cross-border manner. So originally, Hungary participated to the EPSOS 2 project that ran from 2010 to 2014. At that time, AST was not yet available. Actually, design and development was so at that time, we were only able to pilot e-prescription and patient summary as country B, so the receiving country. And because there was no national central system, it was provided through the Open NCP portal. And during the Connecting Europe Facility has DSI projects and other projects after that. We will go live with both e-prescription and patient summary in both the country A and B role in the relatively near future. So the PPT and PET tests have been successfully passed, but there are some semantics problem. Mainly it's about having the official seal on the translations and the transcoding. And so not yet having this seal prohibits going live, but it will be solved in the near future. And also there is an ongoing project that will extend the scope of documents, the original documents, imaging reports, hospital discharge reports, and laboratory reports. So the full EHTS set of services. So to summarize the key facts about AST, it's cloud-based, but the local systems are still available. And if there is a communication on AST and the local, then the data which are already there are used. So life doesn't stop when you can't access AST. Authentication of health professionals is mainly obtained through an EID card, which makes it very safe and secure. And the EID card can also be used for patient identification. For example, it can be used in pharmacies to redeem the prescriptions of that patient. Uniform authentication is there. And for health professionals, it is based on authentic public registries, prohibiting data leakage out from the system. It is sector neutral from the point of view that it is not meant only for reimbursed healthcare, but also obtaining private finance care will also be sent to the AST, and there is a legislation about what kind of healthcare providers must connect to AST, but all the other remaining healthcare providers can choose on their own to connect or not. Using AST will provide new digital process, already provides new digital processes and new access channels through the various portals is available, and it's currently being extended. The US services, I think the most important is the personal health record and the upcoming cross-border data exchange. And thank you.
Thank you, Sergey. Very interesting. So I think also Leah will cover the aspect of the roadmap towards EHTS. So please prepare to share your slides, also Leah.
Thank you,
Thank you.
Karin. Thank you. Can you see my slides?
Yes, we can.
Great. Thank you. Good afternoon, everyone. It's a great pleasure to be here to share some insight into how the EU projects and EU initiatives are driving the digital transformation of Hungary's health system, from the strengthening the national capacities, fostering interoperability and advancing alignment with the European Health Data Space, the EHDS. In particular, I will outline how these European initiatives, these EU projects are supporting both the primary and the secondary use of health data, translating the outcomes into sustainable national strategies, infrastructures, and practices. So the central pillar of this progress is the ESD. Through this infrastructure, we are strengthening both the primary and the secondary use of health data. On the primary side, this means improving the cross-border the healthcare services and ensuring that patients can access their own health information, health data easily and securely. On the second use side, we are working towards advancing the secondary use of health data for research, innovation, public health, regulatory decision-making within a trusted European framework. And all these actions are deeply connected to key European initiatives such as XDHR, My Health at EU, and Health Data at EU, which basically form the core interoperability architecture and policy framework. Several ongoing European projects help us moving in this direction. Starting with the access and continuing with the EHDSI, this laid the foundation for the cross-border exchange of patient data and e-prescriptions, as Gergo already mentioned. The XE has then the Expand DH focused on developing the exchange format. The XHR initiative then defined and still defining is working. They are working still on deliverables, the technical specifications and services, complementing this XDSI and has worked on advancing semantic interoperability for imaging, lab reports and discharge reports. And more recently, the EHDS2 pilot tested the implementation of the EHDS principle regulations in real-world settings, providing practical insights for deployment. Meanwhile, the TEDS and now the TEDS2 are concentrating on developing governance, infrastructure, policy frameworks for the secondary use. Together, these initiatives have Hungary prepare both technically and institutionally for the EHDS. This slide highlights the impact of the ESTA on primary data use. The platform enables secure data exchange across healthcare provider and supports integrated clinical workflows by connecting hospitals, outpatients, providers, and pharmacies. Continuous development of the system ensures that the system remains compliant with EU standards and interoperability frameworks. And with the support of EU-funded projects, core digital health services such as e-prescriptions, e-referrals, and structured patient summaries have been rolled out and now part of routine clinical practice in Hungary. These services enjoy broad social acceptance, And among all national data services, the EST holds the highest level of user trust. The EXTI joint action which builds on the EHAS results in line with the EHDS regulation, is defining the technical specification, as I already mentioned, the data models and the service requirements for interoperable electronic health record exchange. The EXTI project focuses on semantic interoperability, particularly for imaging exams, lab results, and hospital discharge reports. In Hungary, this is implemented through the NCPE gateway specifications. Key activities include structuring and coding clinical documents according to EU guidelines, mapping and translating master value set catalog terminologies to national requirements, using the master translation, transcoding catalog, and leveraging the central terminology services provided by the EHDSI solution providers. And MyHealth at EU supports the secure cross-border access to citizens' health data, including the e-prescriptions and patient summaries, preparing Hungary for the future integration with the EHDS ecosystem. Recently has been launched a new joint action, the ECAN Plus, which focuses on advancing digital transformation in cancer center, in cancer care. The project integrates the XTHR, MyHealth at EU and Health Data at EU outputs into the ECAN Plus framework and develops implementation guidelines for the ER exchange format tailored specifically for the cancer centers. The two core aspects of this project is the integration with existing EHR systems and enabling the cross-border data exchange. This slide highlights Hungary's engagement in the secondary use of health data through the health data at EU platform and with the EHS 2 pilot project. The health data at EU platform provides a protected and regulated framework for the secondary use of health data. It connects the health data access bodies, HDAPs across Europe, which manage secure and authorized access to national health data. They do not store all health data centrally. Instead, HDAPs coordinate access across different sources, hospitals, registries, and and the EHS 2 pilot project complemented this framework by testing and validating the technical and procedural components that underpin the health data at EU. And to mention that TEDAS and TEDAS 2 as well, these provide practical guidance to support harmonized implementation of the EHS regulation. They cover the data security and management, access procedures for HDAPs, financial and legal frameworks, and citizens' rights, including opt-out and notification of significant findings. I would also like to mention a national project, the National Health Metadata Catalog project, led by OCFÖ in partnership with DKF, and the ESKF, which aims to establish a comprehensive national metadata catalog for has data to support secure standardized secondary use. This catalog enables efficient data discovery, access, and reuse of the at national level, providing a structured framework for metadata harmonization. It is explicitly aligned with EU-level initiatives, including the health data at EU, the TEDAS, ensuring that the secondary use infrastructure is compatible with European standards. This slide outlines the development of the National Health Metadata Catalog from vision to the implementation. Look ahead. I would like to conclude few key takeaways, key messages emerged from Hungary's digital health journey. First, the EU collaboration continues to act as a catalyst for national progress, inevitably, and participation in EU-funded initiatives accelerates Hungary's digital transformation and ensures alignment with the EHS. Robust metadata frameworks and IT architecture are also essential. A well-structured metadata catalog and interoperable infrastructure support both primary and secondary data use, fostering the continuity between the national and EU systems. And at the core, of course, the data security, the traceability, and the accountability, the fundamental wider interoperability and data quality are strategic priorities to ensure meaningful cross-border use of health data. And lastly, as an opportunity, would be moving towards user-driven data governance and maturity, enabling the health data to be used safely across the life cycle, lifelong, and even across generations. Thank you very much for your attention. I don't know if you have time to take some questions. I have seen already a few questions in the chat.
Thank you so much, Orsolia and Gergely. Very interesting. Indeed, we are already a little bit over time, but I would like to go over the questions. Do you have statistics on how many patients access their data through the patient portal? Do you know, Gergely?
Unfortunately, I don't have up-to-date information for that. So, OKFÖ is one of the e-health agencies in Hungary, but EST is operated by another e-health agency, the SFK LLC, and they are the people who have up-to-date information. But I think it's in the order of millions. So at least the possibility is there, definitely more than 1 million citizens out of a bit less than 10 million have the e-governance access. And if somebody has the e-governance access, he or she can immediately use AST without any additional registration tasks. But the actual real usage, unfortunately, I don't know.
Thank you, and I completely understand. What about the use of fire in the future in Hungary? So I understood that it's telemedicine that is in fire. All of the other standardized documents are not yet in fire. Will you move towards fire for e-prescription? For the patient summary, is fire considered or prioritized? Will there be APIs that are designed and developed? So a very big question on fire. Can you, Gergely or Solia, reply briefly on this?
So what we know is that the new use cases of EHDS are based on European EHR exchange format. That means FHIR. So in the future, AST will need to implement imaging reports, laboratory reports, and hospital discharge reports in FHIR for cross-border use. So that will be definitely available in a couple of years. So if I remember correctly, the mandatory date for that is 2031.
But for e-prescription, it's March 29. Patient
Yes.
summary, the prescription and dispense, the date is March 29.
Yes. So for cross-border purposes, AST will make these upgrades. Whether the same format will be used within the country, so replace the already existing structures for example, for e-prescription, e-dispensation, for patient summary, for the already existing lab reports. This is a strategic question that can be answered not by OCFU, but by SFK, because how the ST works within the country is completely in their role to decide. But I think definitely the option to also introduce EHR exchange format based structures within the country are a valid option and in consideration. But I don't know about a definite decision yet.
And what you're doing about for telemedicine in FHIR, are these implementation guides openly available? Do you know?
So there is a specific interface which can be used by medical device vendors to send such data to AST. And there is, again, a well-regulated procedure how a software vendor can get the API documentation from ASFK. You have to contact ASFK, sign an NDA, so a non-disclosure agreement, and then you will have access to the API definition and also have access to the so-called dev environment when you can play around. Of course, not with real patient data, but with simulated patients and simulated data.
Very interesting. We cover one final question, and I think we could talk for 1 hour more because it was very, very interesting. Final question from Adam Cover. Can you comment on access to electronic structured package leaflets and SMPCs in Hungary?
That's you mean the package leaflets for medicinal products?
I think so, yeah.
So that is a bit different. So the medicinal products are maintained. I mean, the registry of medicinal products are maintained by a separate governmental agency. It's called NNDK in Hungarian. So that's the Hungarian drug agency and the General Surgeon's Office. And this agency is responsible for registering the medicinal products that are allowed to be used in Hungary, and they are responsible to publish the package leaflets, both for physicians. So actually, that's not the package leaflet, but the instruction manual for drugs for professionals, and the package leaflets for for citizens, and unfortunately, I don't know about the status of digitalization there. I think there were some plans to make it happen, but unfortunately, I don't know the details. In principle, such information could be available from AST because there is a so-called master data management module of AST that also allows to have the access of such registries if such information is published to AST, and actually already anybody in Hungary can have a look on the published code tables and other kinds of published information in AST, because this is not personal information. These are public code sets and public classifications. So if an NJK makes these digitalized leaflets available and publish it to AST, then these will be available from AST. But when that would happen, unfortunately, I don't know.
Thank you so much for clarifying this. Once again, thank you, Orsolia and Gergely, for your presentation. I hope to meet you in person soon so that I can ask all of the other questions that I still have in my head. So we'll stay in touch. And thank you once again and have a good day. And for the others, please stay tuned for our next webinar on the 28th of November. Thank you all. Have a good day.
Thank you very much.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you very much.
Bye.
Bye bye.